Hello everyone. Welcome to our one more marathon. Last time's response to our marathon was very good. Thank you so much. So we got a lot of responses, like people really enjoyed about last time's marathon, which was on Alan's keynote. So we thought of coming up with one more marathon. So this marathon is not going to be just one, but a series of marathon, because we have chosen Boger Synoptic Key, and as you know very well, that Boger Synoptic Key has 323 remedies, so it will be very difficult for us to run through all them. So we have chosen to go very alphabetically, and today we're starting with A. And to run this marathon with me, I have my very dear friend whom I would like to invite today. He is none other than Dr. Jitesh Sharma. He is extremely popular among students. One of the main reasons for his popularity is the clarity with which he has been sharing his knowledge on his Telegram group, where he not just discusses his success but also his failures. So a lot of students connect to him, a lot of students want to learn from him. So I thought not just me, but let both of us share this opportunity to bring out with you this very interesting topic of Boger Synoptic Key. We are doing alphabet A today, and I'm inviting my friend Dr. Jitesh Sharma. Jitesh bhai, if you can join us, we'll be really happy. Dr. Jitesh Sharma stays in Jharsuguda, Odisha. He's a very passionate homeopath and a very dedicated homeopath who is not just, he just doesn't have an OPD but an homeopathic IPD. So I hope you all can hear me very well. I'm audible.
Hello, good evening.
Good evening, Jitesh bhai. How are you?
I'm good. How are you?
Thank you so much for joining. I'm fine.
Thank you for
And
everything. Actually, you have taken a great initiative, and I have been following you, so I have been seeing like how you're running marathon. It's so beautiful and it's so helpful for each and every students. We really want this actually. It's not just me. I
so
think every homeopath needs this.
So this marathon is especially for lazy people, those who don't want to go out and run marathon. So ये एक metaphorical marathon है जहाँ पे लोग ऐसा बोलेंगे कि हम भाग रहे हैं लेकिन हम पढ़ रहे हैं.
No, somebody said to me that, please, sir, you're taking like A and you're taking so many remedies, and even if you read 5 remedies, uske aage to everything goes bouncer. So after 5 remedies, it will be like blank. What to do? And we said, okay, let us see.
No, but see, this is not a replacement of any other knowledge. Like you have to read your books. Am I audible? I think Jitesh bhai has frozen or my network is bad. Can you just am I audible, everybody? Can people listen to me? Can people hear me? Somebody please message just put a thumbs up if I'm audible. Okay, I'm audible. Some people are saying I'm audible. So let's just wait for Jitesh bhai. I guess his network is a little congested. Yeah, he's joining again.
Yeah.
Yeah,
Sorry
you're fine.
for the interruption. I
No,
don't know.
no
Yes, yeah,
problem.
it's better.
Network, because of heavy rains, we all understand that there may be fluctuations of network.
Yeah, definitely. So now
Yeah.
it's fine. I think
So,
everyone can say yes if everything is
yeah. So
clear.
if everybody is able to connect, just put a thumbs up. So we'll start running now.
Yes. So please,
Jitesh bhai,
sir,
you
please,
start.
sir, you take the start. No, sir, you start.
No. You have to open the innings. I'm at the non-striker end. You have to open the innings. But let's start with Abrotanum. So just about the Boger Synoptic Key. In case if there are any students, there are juniors who don't know, Boger Synoptic Key is going to be very specific about what area of the body is affected with the remedies, and Boger emphasizes more on physical generals and modalities. Okay, so here is an Abrotanum. Jitesh bhai.
So Abrotanum, we all know it's the first thing what we can think of marasmus, lot of marasmus, and especially the legs are very, very emaciated. And also Abrotanum is a wonderful remedy for pleurisy, right, of the lungs.
Yes.
When brainia fails.
Yes.
And
Yes.
Abrotanum has more of, especially piles, piles which is burn on touch that Abrotanum has. And also you can find their aggravation is on more of cold and what metastasis. We all know about metastasis and also check diarrhea. Yes, something is, suppose you are treating a case of rheumatism and something is get suppressed, then you get diarrhea, or you having diarrhea, then you got rheumatism.
Yes.
The metastasis, the sphere of action, it changes their location.
Yes. It changes the location. That is one of the most important symptoms. And in Boger Synoptic Key, wherever you start, this is in general for everyone. The very renowned homeopath from Calcutta taught me this. That the first two lines are the most important lines of Boger Synoptic Key. The first two lines. If you have read the first 2 or 3 lines of the first sentence, yes, numb and weak. If you read the first 2 and 3 lines, that's more than enough. That gives you a complete gist of the remedy. So that was really well, and I think there are a lot of times when you will confirm the descending rheumatism,
emaciation. Descending emaciation as well, and these people cannot hold up head, like especially of the CP children as well. So you can think in cerebral palsy also if all symptoms are indicated.
Okay. So the next remedy is Aconite. Aconite, we all know very well that Aconite comes with lot of suddenness. The first word itself is violent, sudden, and acute. The whole remedy, the whole gist of this remedy lies in these 3 words, where there is absolute suddenness in all kinds of symptoms. There is suddenness, there is sudden fear. The fear is the most important symptom of this whole drug, where there is lot of fear, there is lot of terror, there is fear of unknown origin. Some authors have mentioned this, that there is fear of unknown origin. People have fear with almost all the complaints that they suffer from. Jitesh,
also they have feeling like
inputs?
Yes. It's like they have a feeling like earthquake. It's earthquake coming up, and they are very strong people, but they can be physically, but mentally they are not very strong. That's a difference in Aconite.
Yes, mentally they are not at all strong, and they have this constantly. In modern day, maybe you will get a lot of when you will get a lot of patients of anxiety and neurosis. When they just enter your clinic, they give you lots and lots of WhatsApp chats and YouTube videos and a lot of Google searches that they have already done for the diseases. So maybe that is a very good remedy to start with. Maybe your constitutional remedy will definitely come up. But if you open up the case with such remedies, definitely the amount of success that you get will be much better.
I have found more of chronic fears. Those person have a lot of fears. Like in the Boger, it's remote fears.
Yes.
Remote fears. And ailment from fright is generally what? Aconite, opium, and stramonium.
Yes.
Right. So the first remedy from the fright and their fear of death, if any emotional mishap happened, right, and he got shock, okay, I may also die. So you need to elaborate which type of fear he has and what are the symptoms coming up. Then we can think of Aconite as one of the remedy, as a possibility.
Also, one of the very popular remedies of as an anticonvulsants in homeopathy.
Okay.
Okay, so let's go to the next remedy.
Next,
Like everybody,
Actea Spicata.
Actea Spicata. Yes.
So Actea Spicata is a specially remedy for old age people, where as per Boger, and it has a lot of tingling, and where the spear, like all the small joints like colophyllum, sticta P, viola odorata, these are the remedies which we generally think of. But
Yes.
let me tell you, just to add out of the way, Professor Vitolkar used to say Actea Spicata is mainly for males and Semicifuga is mainly for females.
Semicifuga is for females. Yes.
Yes. And Actea Spicata, you can see there is written hypersensitive to cold.
Yes.
So they
Yes.
cannot tolerate cold in any form. In this way, you can have a differential diagnosis with differential remedies of with Ledempal, because
Yes.
Ledempal loves cold even in rheumatism. So that way we
Yes.
can differentiate.
Also, my elder brother Ranjanda, who had taught me this, that in the comparison you see colophyllum, if you have all the complaints matching in a multipara female, colophyllum. So it's very easy to switch into these remedies. You just have to pick up one word and one line into this.
True.
Also, for Aconite, our very dear friend has written, Dr. Atul Mahajan writes that remedy for the year after COVID. So thank you so much, Atul bhai, for your input.
Yes.
Let's go to Adonis. Adonis, again, when you open up Adonis, you will see heart. Is the first word that he writes is heart. That's the area of affection that is given, and it's wandering pains. So here, when we read in Adonis, the whole precordial area is affected. You won't see the pains like of Berberis vulgaris or pulsatilla or like Abrotanum, where the pain metastasizes to one organ or the other. It's just the left precordium that is affected. You will see a lot of changes of the pains and aches that is coming up. It's almost like an anti-angina remedy for homeopathy. Adonis.
Yeah, it's called as heart tonic as well.
Yes.
And fatty heart,
Yes.
cardiac hypertrophy, also Adonis. The best part is you can think like pulsatilla, but it's thirstless. And same,
Yes.
Adonis is also
Yes.
thirstless.
Yes.
And Adonis also has a rheumatism of spine, as you have seen. It has more of spine along with heart complaints. So his neck gets stiff with the heart complaints. And there may be dropsy as well.
Yes. There are dropsy. There are symptoms of dropsy, and what you said is maybe pericardial effusion is one of the very important remedies. Just like you have dropsy, you have also the lot of symptoms of pericardial effusion.
So you can have a DD with apocynon, thirsty and thirstless.
Yes,
so Adonis will be thirstless, and
Yes.
apocynon will be thirsty.
Thirsty. And also very important is sleeplessness of Adonis, maybe because of the sleeplessness can be because of pain, or maybe the anxiety, because there is a lot of angina symptoms coming up. Maybe all these symptoms are quite syphilitic, though they arise more in the night, so that might cause the sleeplessness of the patient.
Yes, coming up next, Aesculus.
Next is Aesculus.
Backache with piles.
Yes.
Or backache with piles where there is no blood or scanty bleeding. You can also think of Aesculus. And Aesculus has a typical knife sawing pain in and out. And you can find all sphere of action where in veins. So all the portal congestion cases, even in portal hypertension also I have seen Aesculus has been one of the most prominent remedies to be thought of.
Yes. Recently, just adding to Aesculus, that recently when we had gone to Pune and Dr. Master and Dr. Sanjeev Dore sir, they were all together and we were discussing Materia Medica. So this is like a gem of, like when all these pioneers and stalwarts are talking, you get a lot of knowledge. So they were discussing that Aesculus, when there was some patient of severe lumbago who was almost bedridden, and there was a lot of things were tried on him, and then sir said, I gave him Aesculus 3C because the area of action of Aesculus is lower.
More of spine, yes.
It's more of lower lumbar and sacral, lumbosacral region is so specific that almost if nothing is working, Aesculus in low potencies will really pick up your case.
as it has written, sacroiliac region is more affected part here. So even
Yes.
Aesculus patient, even if he try to get up from the chair, he
Yeah.
cannot try. He tries, but he cannot get up. That's the more
Yeah.
prominent observation what I have seen of Aesculus because of the weak sacrum.
Because of the weak sacrum. Yeah. Okay. So let's go to the next remedy, that is Aethusa. Aethusa, as we all know, has a profound action on brain. It is and in pediatric cases, but again here you see there is violent onset. The vomiting that comes up is very sudden. A lot of times this vomiting is related to two areas. That is, maybe one is neurological origin, which is mentioned in the first line itself, that is brain, or that may be because of gastric origin. Maybe there is gastroduodenal junction. At the gastroduodenal junction, there may be a lot of time hypoplasia. There is sometimes thickening of the area, which might lead to this. But the vomiting is very sudden, and it comes in a way of projectile vomiting that causes a lot of exhaustion.
Same Aconite also has projectile vomiting.
Yes.
And Veratrum viridae. Yeah, yes, that was written. And one of the main remedy in cerebral palsy is also Aethusa, where there is deadly cold appearance. And typical of Aethusa, they cannot hold head up. That's also in Aethusa. Yes.
That's
they
not
cannot
holding
stand
head
and cannot stand as well. That's in Aethusa.
So in few authors that I've read was that this lack of reaction, lot of people have picked it up in a way of coma also.
Yes.
Lack of reaction, which is mentioned by various authors. Maybe there are some authors who mentioned that they've used Aethusa in cases of coma, because the coma is also lack of reaction. And also,
same wise, Aethusa has a fear of operation. And Aethusa feels if she goes into any operation theater,
surgical procedure.
Surgical procedure, she may never wake up. That's a typical of Aethusa.
Yeah. So maybe any post-surgical neurotrauma, all these remedies we can really think of where there is a lot of fear of darkness. And again, there is a very good case that we had, that this children have a lot of time, they have this curdled vomiting coming up. So Aethusa was given in rising potencies, but there was no relief. But then one dose of Decentrico really helped the case. So one joining nosode for this remedy would be Decentrico.
Definitely, Fobister has clearly mentioned is the importance, and Marguerite Blackie has also told a lot of times. Decentrico is an excellent for cyclical vomiting. Decentrico is one of the beautiful remedies.
Yes.
So coming up next, Agaricus Muscaris.
Agaricus
Muscaris. Agaricus has an action of cerebrospinal axis. So everything, numbness and prickling in the soles, involuntary movement or eye oscillating like a pendulum, everything involuntary. And when the patient sleeps, he usually complains of the twitching or jerking involuntary. That's the first thing to think of Agaricus. And it has been written gradual onset. It's very, very, very gradually the complaints get worse.
So, and a very contrasting feature. The contrasting feature. Aethusa में लिखा है violent onset, Agaricus में लिखा है gradual onset.
Gradual onset, yes. And the most interestingly, Agaricus people, and also compare with Cocculus indica also. It has been the head is involuntary and they'll come and keep on jerking while they're talking also every time to and fro. Because slightest you see involuntary twitching, the first thing comes to mind, okay, might be Aethusa, might be Zincum, might be all the involuntary remedies which we can think of. But the first remedies come with that is Agaricus with everyone's mind. But Agaricus, let me tell you, it's a wonderful remedy where needle-like sensation in the spine.
And chilliness.
And also, and the chilliness.
That I guess that is what is really a differentiating feature of chilliness. And one very nice clinical tip that was taught to us was cough that ends in sneezing for Agaricus. Cough usually ends in sneezing.
If we talk about this frostbite also, chilblains, Agaricus and Pulsatilla are the two important remedies. Let me tell you another remedy which is not in Boger Synoptic Key, out of Boger Synoptic, that is Thymus. Thymus is a remedy. Thymus is
It's given in
another
Clark.
remedy. It's given in Clark. It's a wonderful remedy because we all have learned about Agaricus and Pulsatilla, but we know, I think hardly people know about Tamus.
Tamus has all the hardness.
Yes.
Tamus has all that hardness, thickness.
In the chilblains.
Cracks.
Yes.
In the chilblains.
In the chilblains.
Yes. And Agaricus Muscaris is almost specific for all the types of ataxia. May it be cerebral, may it be sensory, or may it be vestibular. So if you are managing a case of ataxia where you're not finding lot of symptoms where you don't have that focus in the case, maybe there is something to start with. Agaricus would be a very good remedy to start with. So let's go to the next remedy. Agnus
Castus.
Yeah, Agnus castus, we all know, is a very specific remedy for sexual organs where there is impotency, premature ejaculation in old age, jaded rakes. So it's all because of old memory, senility, that all these symptoms are coming up. And it is very well written that it's related to phosphoric acid. It is given in the comparison also that phosphoric acid is very close to the remedy. Also, the other remedy what I would think of is selenium.
Agreed. Selenium is one of the remedy which we think of, premature senility. Yeah. And you know, Agnus has a typical symptom for aglatia, where there is no milk, lack of secretion. Agnus, yes, aglatia. Yes. And you know, the jaded rake is actually meaning, I think everybody is aware of something which can be aroused, but now they cannot. So that is a typical meaning. That is a meaning. So now that is the jaded rakes has been given, and everybody was scientists. You know, they have made the books with such a difficult
lot of scientificity. Maybe that I think we don't have that scientific approach with the amount of what they have written is.
Okay, next Ailanthus.
Next is Ailanthus.
Ailanthus is amazing prostation plus tonsillitis. It's an amazing remedy for tonsillitis. I think everybody knows about we know mercuries and we know Hippus. But for the Ailanthus glandula, there is actually more dark and redness than belladonna. It's more congestion, Ailanthus glandula. And there could be malignancy of the tonsillitis as well. Yes. So that is very prominent here. Yes. That's why there is a relationship with lac caninum, because lac caninum we know recurrent tonsillitis and it can change side to side. But in Ailanthus, glossy, correct. Ailanthus has written deep ulcer stud tonsils. That's a typical word. Deep ulcer stud tonsils. That's very, very important.
I guess that line needs to be that line needs to be understood, because a lot of authors have almost given this as a specific for cancer of tonsils.
True.
Because we don't have many other remedies for tonsillar carcinoma.
Correct.
There is very limited scope, hardly any remedies for tonsillar carcinoma and pancreatic carcinoma. Otherwise, we have a lot of range of remedies for every cancer that we see. But in these few organs, there are very few remedies.
The only thing is very prominent here is stupor. Like it's having a Boger stupor. So there will be rapid prostration. It doesn't have rapid prostration. So they'll very, very rapidly they will sink due to the symptoms.
Yes. Again, the same. Right, all the symptoms that we are discussing are of diphtheria also.
Correct. But nowadays we see very less. So
very less, but still. So next remedy, let's go to next remedy, that is Aletris Farinosa. Aletris Farinosa, again, a very specific, like the other one was male sexual organs, this is female sexual organs. It's a very specific area of action. There is a lot of debility, there is a lot of tiredness leading and to the heaviness of the parts, maybe the lower abdomen, maybe the uterine region, but there is also a lot of hemorrhagic tendencies.
Let me add few points.
Yes.
Aletris is a wonderful remedy for weakness in the pregnant women.
Yes.
Who pregnancy, they are suffering from, they are pregnant and they have a lot of debility and they cannot rise up. Aletris is one of the medicine which can help them.
Oh.
And you know, relationship is with China. So the prostration is as equal
to China.
Yes, because it is the same aggravation by loss of fluid as we have a loss of vital fluids in China. That's
loss of vital fluid.
Vital fluid and loss of fluids.
Fluid.
These two things separates with China and Aletris Farinosa.
Aletris Farinosa. Hello.
So next,
let's go to aloe.
Allium Cepa.
Allium Cepa. Okay. Okay,
Yes.
let's start with Allium Cepa.
Allium Cepa, we all know it's an acute cold remedy which is being used, and this has typical lot of lacrimation in the eyes along with coryza, and also neuralgia after stumps that we all know about it. It has
Linear neuralgia, what we call.
Yeah, I'll tell you something interesting which I think many people know or not. For especially of soles which get rubbed by friction,
Yeah,
and they get soreness in the Allium Cepa is one of the beautiful remedies.
shoe bite, peonia for
Shoe bite.
peonia,
Peonia.
shoe bites. Peonia and Allium Cepa are a very good specific remedies for both.
Yes. And Allium Cepa has a typical redness in congestion. Congestion is allium.
Yes. Yes.
So this is the remedy in which it has written they have so much of cough. The cough feels like larynx will split, tearing sensation in the larynx. So there will be so much complaining of pain while coughing.
Yes.
Along with this, lacrimation is a prominent symptom for Allium Cepa, and they get aggravated from worm. So this is a hot remedy by thermidor.
So out of ENT symptoms, if we are to just highlight two symptoms, I guess two clinical conditions, one would be linear neuralgia and other would be shoe bite, which these days in rainy season, it's very common. The shoe bite, people are going to get shoe bites very easily.
Yes, and also the senile bronchitis for Allium Cepa, for old age bronchitis. And let me tell you, if you talk about old age bronchitis, I don't know how many people are aware about enteritis for children, all the bronchitis, same as hyposenium is for old age.
It's for old age.
Bronchitis, that is hyposenium.
Okay. So next is aloe.
Yeah, aloe.
So aloe again, he mentioned Boger Synoptic Key mentions a very boldly that abdominal veins. What he means by abdominal veins is what we have, that is portal congestion. So portal congestion may be the liver at the level of portal congestion. Maybe you may experience at the level of liver, at lower esophageal varices, or in the rectal area where there are a lot of piles. There is bunch of piles. There is a lot of noisy. There is a lot of rumbling in abdomen. Where there is urgency to weigh, where there is urgency and there is lack of confidence on sphincter ani.
Yes, weakness of sphincter, and even they feel like, and you know what the best part of aloes? Patient will tell you that I pass flatus a lot, then stool comes. The first thing comes in the mind to think of aloes.
Aloe. I have not seen any. Yeah, please.
I have seen, and aloes has a typical differentiation of when we speak of hemorrhoids, we speak of differentiation between cold water and hot water. Aloes is better by cold water.
Cold
water. That's what differentiates. Very specifically.
And
aloes.
And what I wanted to say is that I have not seen anybody using aloe as much as Sarkar sir is using, maybe. Because Sarkar sir, once you have a case of liver cancer, is I think one of the close where he will come down to narrow down to the group of remedies. One of them is going to be aloe. So I've seen him using aloe where patient comes with liver cancer. If he's holding his hand on the hepatic region, like better by rubbing the right hypochondria में, बोले aloe शुरू करते हैं.
And the next remedy is podophyllum.
Yes.
Better by rubbing. Yes.
This whole all the same set of symptoms, and another is podophyllum. So anal weakness, we should remember anal weakness, and even in Boger Synoptic Key, podophyllum is one of the complementary remedies to aloe.
Yes.
Next is alumina.
Alumina has been written spinal cord in the lumbar region. So all the locomotor ataxia, involuntary gaits, jerking, twitching, involuntary, speed, it will be very speed. So there is a word written festination. Festination defines that involuntary quickening of the gait.
Yes.
So it might be, they will be twitching, involuntary, and which will be violent. So even if they walk, they have a waddle gait, and they will be very much involuntary. So that is main of alumina. And what is this? Paralysis of the rectum, paralysis of all body. Everything will be slow, sluggish.
Yes.
Everything will be slow in alumina.
The whole lumbosacral spinal area goes into a lot of paralysis, and I guess that is causing more
Yes.
of
That's
constipation.
why sclerosis.
Yes.
In sclerosis of spine, multiple neuritis, multiple sclerosis, everywhere is alumina. And especially the rectum, they need to plug out the stool from the finger.
From
the
mechanical
finger. Same
extraction.
as mechanically it has to be removed like opium. The same goes with alumina. So
plumbum.
you know there is a word paresis. Yes, plumbum also. Paresis. Paresis stands for alumina, plumbum, causticum. So everywhere there is a paralysis, like it could be either part or whole body.
Yes.
So that's where, and the specific relationship which shares with brine, the dryness. Everything is dry. The skin eruptions are dry. Yeah, dry. Everything is dry. That's why I call dry equal to bry.
Dry.
So dry equal
last
to
when
brine.
I had my class in Thailand, I taught them in the same way. Bryonia is dryonia. You have to think it that way. Bryonia is dryonia. Okay, so just one thing I want to say in alumina that I have learned from Dr. Farooq Master. He had taught, I guess, alumina for 3 days to us, and the whole thing, what he taught us was, if all of you, anybody who is interested in reading a lot of psychology, if there are any students who are reading a lot of psychology, they should go and read. There's a very nice psychologist that he had that he mentioned is psychology. No, not Freud. Okay, I'll tell you later on. Sorry. Anal fixation. Who had given the theory of anal fixation? I'll write it down later on in the chat. I'm not able to recollect the name of the. So he says that anal fixation. If you read anal fixation, go online, read anal fixation. You'll find lot of anal fixation, identity crisis. All these things are part of alumina, and lot of psychologically, psychosomatically, if you want to correlate to. But what we are talking is from Boger Synoptic Key, so we are talking a lot of pathological things. But if you want to read the psychosomatic correlation of alumina with identity crisis and with anal fixation, I think I'll give you the name of the author later on. Not Philip Bailey, not Catherine Coulter. I'll give it on. I'll write it down in the chat.
I remember alumina is the remedy where he cannot buy his own clothes.
Yes.
He cannot decide what to buy. He's always confused, and it's not like duality like anacardium. It's more of he doesn't know what to choose. That's where the confusion is in alumina. And alumina that running down to heels, leucorrhea, or especially leucorrhea, where it comes down to heels.
Yes.
So we think of alumina at that time.
Alumina. Next, let's go to Ambra Grisea.
Yes.
Okay. So Ambra Grisea again has a very the whole remedy is very one-sided. Either one part or one side, everything will come down to either one side or one part of the symptoms. So there is a lot of dryness again here. There is nervousness, meager habits. So these sluggish habits, basically old age patients are more correlated, where in geriatric age group, when you wake up in the morning, you don't know what you have to do. So all the rubrics, if you study of Ambra Grisea, they are aggravated in morning. There is vertigo in the morning. So they don't know, what will I do today? What is my purpose of life? If you read the psychology, all the mind symptoms, you will really be able to correlate a lot with Ambra Grisea. So all these pains and all these aches are also related to one elbow joint, one knee joint. All these are the areas of Ambra Grisea.
Yes, that's why it has been sharing a relationship with Bratacarb. And Bratacarb is vertigo in old people or sleepless in old people. The first remedy comes, that is Bratacarb. And that's why vertigo of Ambra Grisea is also for geriatric cases. It's very, very helpful. And even they become like child, the same like Bratacarb childish behavior.
Bratacarb child.
Yes.
Next would be Ammonium Carb.
Ammonium Carb is completely for weakness, like exhaustion, like carbo wedge and empty tart. dullness, but more of nasal congestion. And as I said, in respiration and lungs, even for the lungs, and rattling cough in the chest, like Antim Tart. You're thinking of midnight aggravation from 3 to 4 a.m. You can think of Ammonium Carb. Usually it has an element of carbon. So like Carbo Veg and Antim Tart has all the drowsiness. It is more deep. Ammonium Carb is more deep than these two remedies actually. It has written lacks reaction, that word, and low vitality. That patient is not at all responding, and it has no energy to cough or to sneeze. It has been profoundly exhausted, early morning sneezing, and typically you see the weakness along with it, sneezing and sneezing. Early morning rising on the waking in the morning, you find sneezing is Ammonium Carb is the first remedy. But due to weakness, due to sneezing, profound sneezing, he gets weak. That is the entry point where you can think of Ammonium Carbonica.
Carbonica. Again, similarly, it's very close remedy. Again, is Ammonium Carb is Ammonium-mur. Ammonium-mur again will come with a lot of areas like fat. A lot of symptoms, I think, for there are similar. Where there is fat and fluffy with thin limbs like Antim crude, and there are irregular circulations. Flabby people.
Yes.
And also there is a lot of shortness. There is tightness, as if it is too short. This tightness and too shortening is more related to the pain in tendo achilis, where there is pain, where you feel that your legs are being pulled. There is, these days you'll see a lot of patients with plantar fasciitis, all these people complaining about pains when they wake up in the morning, when they start walking. So heel pains, heel ulcerations, very well somebody's written that heel ulceration is about to say. So Ammonium-mur is almost like a specific for all these complaints.
And I would like to one thing, most of the homeopaths have abused Ammonium-mur for sciaticas like anything.
Yeah. Agree. Dr. Rihanna is writing shortening of tendons. Yes, ma'am. It's for shortening of tendons that we are discussing.
And interestingly, it has loss of smell in the mucous membranes, loss of smell. The next one with the polyp plus loss of smell, that is Calcarea carb. And another is loss of smell due to mucous membranes affection. You can think of Ammonium-mur as well.
Also, in both the ammonias, Ammonium-mur, Ammonium Carb, the Dr. Farooq Master's book of which is out of print now, that is sour prunes. They are basically sour prunes. If you see, the whole, if you take out single remedy rubrics of
Ammonium Carb.
NER, single remedy rubrics of Ammonium Carb,
NER,
you will relate to all these things, that they are basically, a lot of Mumbai people will relate, where they have to actually they are evening aggravation people. So when they leave in the evening for their local trains, where they have to rush for the local train, they feel the life is so big, life is so difficult for them. They speak all the abusive things, they get aggravated, and life is so, like, let me not use the wrong word here.
No, it's beautiful. It's beautiful to learn.
So it's frustrating. It's frustrating basically. So the ammonias are, most of the times, if you read, they're aggravated in the evenings. 4 to 6 is the time of aggravation for them.
Yes, and Ammonium-mur is like share a relationship with causticum. So causticum, like all the symptoms, that's why it has more of action of sciatica as well, like causticum has. But causticum differentiates because of left-sided sciatica and right-sided paralysis. That's what the differentiate in this. Yes.
Last thing, just about the ammons, that they are extremely bitter people. They have all the bitter things in their mouth. They always speak something bad. They will never appreciate anybody. So let's go to the next amyl nitrate by.
Amyl nitrate, I have never given in oral doses. I have always used for olfaction cases or conversion cases, or even in angina, I have given olfaction. It has been beautifully worked in these cases. Is more of like same as belladonna, amyl nitrate, and glonine, because they share a relationship with it, and also lachesis. But amyl nitrosum is mainly for what heat flushes. So the patient will say that I'm feeling all the heat inside, the same as a lachesis complaint, but it is more intense, actually, more intense. He may even sweat in a dripping sweat. AC is on at the 16 temperature, 16 degree, but still he'll be drenching sweat, and he feel extremely hot. Then you can think of amyl nitrosum.
Like olfaction is very good. Like I've hardly used amyl nitrate orally. I've used for
Yes.
olfaction for headaches and in epilepsy. When you know that when the patient feels the aura, then you know that the family, by looking at the patient, then they abhi convulsion aane wala hai, they would just go and make him smell. Just the olfaction of this remedy will definitely neutralize the epileptic spasm.
Attack.
Yeah.
Yes.
Yes.
You know, the next comes Anacardium orientalis. Yes. The most important remedy.
Yeah. Most important. Anacardium also, you can read a lot of psychological things about it. You can read a lot of it's a very good remedy for few physical complaints like Attendo Achilles. Again, one of the very important symptoms is Attendo Achilles. And again, it's one of the most important remedies for irresolution. You see this irresolution developing of I do this, I do that, there is this intense state of confusion with the word which Boger is using is vacillating.
Yes.
Vacillating, where he keeps changing his ideas. There is bad memory. That is one of the very important symptom here, that is bad memory. But just I'm highlighting few things that if you have a patient who is complaining of loss of memory, where he's forgetting things, what I kept here, when I did this, when I did that, just cross check that the patient is not on any statins, because the first important side effect of statins is loss of memory. If he's on statins and you're thinking of anacardium, I think you're going to go wrong there.
Just to add, anacardium is a wonderful remedy for all the schizophrenia cases. When you find the duality and the hearing and the noises and all the delusional level, and they are fixed about it. I have profound use of anacardium in LM potency especially, and it has wonderful results when patient has this typical of symptoms, where a lot of delusion, sense of duality, confusion, impaired memory, along with constipation. Acha. The next aspect I would like to talk about anacardium is more of rheumatism part, where I don't know how many people know about. Anacardium people have a rheumatic pains which are relieved by hot water. They love to have a hot water bath. Same as Entimcrude also has this. You know, Entimcrude also has this. Anacardium also loves hot bathing. Yet it's an ambithermal remedy, anacardium. And especially anacardium for eczemas actually. And it has more of Rustox kind of, because that's why they share a recipe with Rustox. Anacardium and Semicifuga are the most for the back pains and the chronic pains like Rustox. Anacardium has it.
Somebody has written that there are necrotic tissues of the skin. So that's absolutely what Jitesh Bhai is talking about.
Yes.
Okay, so next is
anthracene. Even I missed about duodenal ulcers. Yes, anacardium is another remedy for duodenal ulcers, where they have as soon as they eat, they feel better. They cannot stay hungry. That's a typical of
what Dr. Heiner Fry is teaching. It is very relatable in this remedy, where there is polarity analysis, where one side we are talking about absolute irresolution, where the person is not able to decide. On the other end, when he decides he's not able to budge, we almost go to the level of schizophrenia, where even the things don't exist, and he feels that it is there, it is there.
Correct.
So this is what is the beauty of homeopathy, where a lot of
that's absolutely true, because every remedy has their own polarities.
Polarity. Yes. So anthracene is the next, and anthracene is a very short. The action of anthracene is to cellular abscesses, to all the abscesses of the septum. There are blue blisters. There is lack of oxygenation. So all these areas where there are a lot of abscesses, I think anthracinum has proved as almost specific remedy.
It's more deep action like arsenic. It's more deep than arsenic. More fitted ulcers, more deep septic ulcers, and septicemia also. We can think of.
But I guess the bluish margins, it gets correlated. If the margins are blue, it gets correlated to Tarantula cubensis also.
Yes, correct. Because Tarantula cubensis has the same severe, terrible burning like anthracinum. We have with us a very respected Dr. Rajendra Srimadi sir. Hello, sir. I hope you are doing well. Thank you so much for joining. So next is Antimcrude. So Antimcrude, we all know gluttony, gluttony. They can
Gluttony.
eat, yes. And they call a gross
He uses the word
feeders.
gross feeders. He uses
Yes,
the word gross feeders.
the term is, that's a
Gluttony.
gluttony.
Yes.
Yes, gluttony. He can eat like a pig. He can eat like anything, and he all have gastric troubles, lot of constipation, and typical sourness. They like to have a sour food, and especially for warts. Wart tendency,
Wart
all the
tendencies.
growths.
Yes.
Even for the gouty rheumatism, entim crude. Like I told you, warmth ameliorates the pain of entim crude. They love warm bathing.
Perfect. So, and that is about entim crude. And in Boger Synoptic Key, you will see it being compared to sulfur.
Yes.
Yeah. So let's go to the next remedy, that is entim tart. Entim tart, as we all know, that has an action on mucous membrane, which he mentions, and very, very important is pneumogastric nerve. There are very few remedies that we have for pneumogastric nerve. One is ipecac, one is entim tart, and once the pneumogastric nerve is triggered, you will see a lot of gastric symptoms, as well as you will see nausea. There is excessive nausea. There is excessive hiccups. All these symptoms will come up. There is the first word what he mentions here is depression, is actually not to be taken in the psychological terms of depression. What he means is a lot of suppression. There is lots and lots of suppression, which causes lack of reaction. The first line itself is a beauty of this remedy. But just don't misinterpret the first word of depression here for the psychological term. It's basically suppressing, that the patient has undergone a lot of suppressions and then creates a lack of reaction. Again, this remedy you will also find in geriatric as well as pediatric age group, where there is intense cough with rattling. The patient, where the lack of reaction can be again correlated to advanced cases of lung failure, advanced cases of cancer of lungs, where the patient's respiratory distress is excessive, where the patient's head is tilted towards the right side, and pediatric cases where you will find your parents telling that डॉक्टर साहब इसको खांसी आता है लेकिन कफ निकाल नहीं सकता है, कफ निकालता नहीं है, because the patients cannot bring up the cough. So it is written in bold that the patients cannot bring up the cough. So pediatric age group, it would be this. Geriatric age group would be a lot of weakness.
Just to add that bronchitis of the infants, like ipecac, we think the only difference becomes ipecac and entim tart, the tongue. The tongue is clean in ipecac and the coated in entim tart. So this becomes a differentiation point when you're treating a bronchitis case of infants.
Yes, it's also somebody. There is Monica G has written asphyxia neonatal, which is a very good remedy. Rihanna ma'am writes that it's excessive sleepiness. I totally agree, ma'am. Excessive sleepiness is again correlating to the lack of reaction that we are talking about. Next is apis. So apis, again, we all know it's a very celebrated remedy for a lot of places where there is tissue damage involved. There is serous cavities. There is shininess. There is glossiness, and there is a lot of stinging. The first word that he uses is stinging. The stinging has to be, I guess, present as in every disease that we are going to talk, or where the apis is going to be indicated. The stinging has to be present. Ascites, hydrothorax, wherever there is collection of fluid, and you want to use as in this, I think this is going to be our lacinectomy.
Yes. Apis, I recently shared today's only case. That's our typical of acute urticaria, large urticaria, rosy urticaria. And we use it in LM potency also. It has marvelous results. Like within 20 minutes, the all got disappeared. And I have been personally experienced apis smell in LM potency has more good effects compared to centesimal scale. Yes. Especially in apis smell. And even in acutes as well as in chronics. The stinging is the entry point, definitely, because the patients feel a lot of heat inside, has been written, flushes of heat, plus urticaria, plus thirstless, apis. So
apis is swelling below the eyes,
bag-like
is above the eyes. Even
Medorinum, and Medorinum also has bag-like swelling on the lower lips.
Yes. So this is a very important remedy, and also the specific area of action, like the Boger also mentions, is kidneys and bladders. So this should be remembered for nephritis, for all the nephritis cases. Nephritis, CKD, and next remedy is apocynon.
Aposanum. Aposanum, like we see weak cases, very, very weak. And even I shared a case, I don't know how many people have said, I have shared a nephrotic syndrome case of my OPD where we used Aposanum in LM potency just because of the dropsical swelling and his belly was completely hard, tight, and he was extremely thirsty. And we used Aposanum and we saw the results within a span of 15 days. Everything got, and his all protein got nil. That was the power of Aposanum plus dropsy plus thirsty. And very weak. So he's very weak. Even in nephrotic cases, when the patient is coming into your clinic, somebody will hold him and he'll come. He cannot walk by own. That's a difference. Now, by this, we can differentiate China and acid phos also. China can reach to your clinic, but acid phos cannot reach to your clinic.
Acid
phos is completely exhausted.
Yes.
That's the typical difference of even if they're suffering from diarrhea or they're suffering from any diseases. That's the exhaustion difference.
That is a difference of exhaustion. Totally agree. The next remedy would be Aralia Racemosa. Aralia Racemosa, again, a very specified remedy towards the respiratory mucous membrane, where again there is a lot of weakness and there is a lot of weakness with cough, and there is a lot of relaxation and nausea. Nausea is very specific to Aralia Racemosa, and there are a lot of discharges. Basically, the nose discharge, the mucus discharge. There are going to be free-flowing discharges in Aralia Racemosa.
You know, in Aralia, it is compared with Lobelia inflata, especially abuse of tobacco. Yeah, Lobelia inflata. Because of abuse of tobacco, they have asthma for lobelias. And Aralia Racemosa, especially, they sit up and they want 2-3 pillows lying the head up while asthma attacks. So they feel much better on that. And they're better by sitting. So next comes Aranea Diadema.
Aranea Diadema.
Aranea Diadema, even if it's sitting in front of fire, they cannot feel warm. That's a coldness. It's very cold to very bones compared with Calcarea carb. Can't get warm. That's the line. And especially in damp rainy weather, all the fevers which are not getting down and extremely chillness, it has been written by complementary medicine, that is Cedron, that is periodic chillness. Periodic chillness that Cedron has, same as Aranea Diadema also has it. And Aranea Diadema, especially for heel pains of the os calci, right-sided, and they walk, the heel pains go away. Aranea Diadema works wonderful. Another remedy of the left heel, you can think of Calcarea causticum with Aranea Diadema.
And Conchiollinum. Another remedy is Conchiollinum.
Yes, Conchiollinum. Conchiollinum is also for periostitis. It's a wonderful remedy for periostitis of bones.
Yeah. So another very when you go through a lot of different authors, you will find it that this periodicity, because of which it is being compared to Cedron. I think malaria is one place where a lot of stalwarts have used it and have got good success. Next is,
and you know, Aranea, let me add one more thing. Aranea Diadema is wonderful remedy for trigeminal neuralgia also. Aranea Diadema is wonderful remedy for right-sided trigeminal neuralgia, and importantly, all his pains, everything goes away by smoking. So smoking ameliorates is one of the remedy, that is Aranea Diadema.
Okay. Argentum Metallicum, again a very good remedy for cartilages and nerves. There are symptoms where there is slow, deep, and there is low grade process. Everything that comes up with Argentum Metallicum is going to be very slow, is going to be very sluggish. There is thickened secretion, unlike what we have spoken about the other remedies where there were free flowing secretions or they were not coming up. There is loss of power of mental overlimb. So there is a lot of chronicity in this remedy, what we see.
For Argentum Metallicum, we know that cartilaginous affections, that is the main. Even it's a, you can call it cartilage regenerator. It has been used for Argentum Metallicum. It's a deep syphilitic remedy, nightly bone pains, and it has a tendency for all the cartilaginous areas, especially, knee joints, cartilage. It has a power to regenerate the cartilage. That's the major action of Argentum Metallicum. We can think of
basically the action over fibrous tissues where you have a lot of cases when you have an ACL tear. These days ACL tears is very common with sports people, where when you're using Argentum Metallicum, again, a nosode that matches to that is Psychotico.
Yes, Psychotico as well. And for Argentum Metallicum is mainly, here is swelling in the ankles, lot of swelling in the ankles. That is very prominent with Argentum Metallicum.
Yes. So again, when we are talking about all these things, the Argentum Metallicum also very good because affects the sight, producing dimness and vision and loss of the vision.
Yes.
It is due to the overuse of eyes where people have, like maybe like sulfur people who have had a lot of reading, they've read through a lot of things, maybe too much of blue screen being affected these days, which is very common with kids. So that would be Argentum Metallicum.
And for that, I know vertigo from overreading, that is one other remedy is arnica.
So that is going to be the one of the next remedies. Argentum Nitricum kar lete hain.
Yes. So Argentum Nitricum, we all know it has a lot of anticipation, lot of anxiety, and they have everything. They are very, very hurried, impulsive people. And like there's a word written, old, dried up, tremulous and weak, and progressive emaciation. So due to worry also he's emaciated, due to IBS also he's emaciated, he's losing weight, due to fear of vertigo is very marked. And the same ordeal is with Gelsemium and Dysenterico, because we always think of Argent Nitricum, but Gelsemium also has a typical symptoms as Argent Nitricum, but Argent Nitricum has a typical craving of sweet, excessive sweet as well, and excessive salt
that
as
aggravates.
well. Yes, that aggravates. So Argent Nitricum needs both. They love salt as well, the same extent to that they love sweet as well. So we cannot be biased only that those who love only sweets we can think of Argent Nitricum. Also the salty who have excessive, we can think of Argent Nitricum, and we think of Nitromur as well. So that's the difference.
Yes. So like what rightly said, homeopathy, Dr. Anam Zahir is writing absolutely that Ophthalmia neonatrum. Yes, I don't think so. Anybody else? We can think of anything else apart from Argentum Nitricum when it comes to ophthalmia neonatrum.
Yes.
So the next remedy, let's go to the next remedy, that is Arnica. I think Arnica, जितना बात करेंगे, I think Arnica पे लोग 3 दिन बात करेंगे. Arnica has a lot of varied actions, and it's a very popular remedy, whether it's on blood vessels, a very painful and offensive remedy. That's what is a key line that Boger wants to give, that it is one you have to have pain, second you have to have offensiveness. Like I was very shocked when somebody taught me that offensive flatus के लिए Arnica दे दो ना. I said यार ये तुम relate ही नहीं किया कभी. It was very wonderful to read that offensive flatus, where it can be it can give a very good result in offensive flatus. Also, a lot of people have used Arnica for comatose condition, post-traumatic condition, where there is a lot of lack of reaction. People have had chronicity of symptoms. So Arnica is not just a good remedy for acute injuries, but when you go for chronic injuries also, I think nothing beats Arnica. In fact, the whole compositive family.
Yes, and for angina, the first remedy is Arnica. Ever you think of, for all the angina pains, you give an LM potency or centesimal. Arnica will never ever disappoint you. Arnica has a great power, and I think it's also for all the orthopedics. I've seen orthopedic prescribing Arnica, Symphytum, like anything, and they are aware of the action, how deep the Arnica works in this kind of cases. Many fractures, Arnica can repair that. Many like Symphytum, Arnica, Bellispi, these are the remedies of major deep value which a homeopath can use on deep cases. It's not just acute, as like you told, like more of chronic cases also. Arnica is wonderful drug, can be thought of.
Yes. So next remedy, I think the whole, if you read N.M. Chaudhary, Arnica and N.M. Chaudhary, you'll be able to differentiate. N.M. Chaudhary writes it so beautifully that I think he covers differentiation of all the composite remedies.
Yes.
And let's go to next is Arsenicum.
Weakness, sudden intense effects, and restlessness.
Yes.
Arsenic people will come and keep on drinking water due to nervousness.
Yes.
And they keep on taking sips.
Yes.
When they're sitting in front of you, and quite nervous look, and they have only fear whether he'll be better or not. And once you are
Yes.
sure he'll be a bit better, then again the nervousness starts with the next question. That's a typical observation in arsenic patients we find clinically.
Yes.
What I wanted to share.
That is great. Arsenic, I'll just share one thing. Arsenic in low potencies is almost like works as a painkiller in cancer patients.
Yes. And
Yes.
let me share, arsenic is a wonderful remedy for flatulence. I don't know how many people know about it, but it's a wonderful remedy for flatulence. Please read from Clark, you read the flatulence. Arsenic is a wonderful remedy for flatulence as well, where there's a lot of discomfort and the patient gets restless due to that. And he's annoying and he needs
Yes.
help. You give arsenic and see the results.
Yes. So next remedy is Arsenicum Iodatum. Arsenicum Iodatum, again, a very specific remedy for respiratory system, where you have had lot of cough that the person almost gets breathless, air hunger, short of breathing, where all the symptoms are usually aggravated in the night, and there is yellow-green expectoration with foul, which is absolutely offensive, like almost like Dr. Rajvi is writing, that cadaverous smell. That you are absolutely right. That is what I'm about to say. The cadaveric smelling discharges from upper respiratory. If you have that in a case of cough, I think as you will not miss out Arsenicum Iodatum.
Yes. And coming up next, Aurum Triphyllum.
Yes.
Aurum Triphyllum is the first remedy to think of voice hoarseness. All the singers, public speakers, the first thing we should think of Aurum Triphyllum. Now another remedy I would do, instantly voice producer. It has been written coca, the mountainous remedy. So to compare this voice hoarseness and the intravenous voice producer, these two remedies. And Aurum Triphyllum, constant picking at the nose and the burning in the larynx and the trachea feeling, along with, interestingly, many people know about impetigo, right? Entim crude we know, miserium we know, Viola tricolor is another medicine for impetigo. Another remedy for impetigo is Aurum Triphyllum.
Yes. Another instant voice producer, I think everybody is writing, is Populus Can.
Populus Can, yes.
Populus
I
Can.
know that.
Populus
So
Can.
I'm telling a bit different.
Again,
which is
again, Populus Can we have used in olfaction. Like you pour some mother tincture in boiling water and you start inhaling the fumes, and it instantly gives you back the voice.
Yes.
Okay. So next remedy after Aurum Triphyllum, Asafoetida. Asafoetida again has a very specific. The main area where it is acts is digestive tract and the periosteum, which is very important. Is periosteum. It's full stout aspect, but intolerably nervous. That's what Boger writes at the first line. Asafoetida, you will see excessive pains everywhere. You have seen pains that extend that are extending outwards. There is everything presses towards throat. That's what is highlighted, and he writes as rancid, explosive belching. That's a very
like a bomb.
Asafoetida is basically the Indian home.
Yes, very
Indian
loud,
home remedy
belching.
that we use. Yeah. Asafoetida is an Indian home remedy that we have been using, I guess, since ages, and this is a potentized form. So whenever you know that there is rumbling, there is loud eructations, there are empty eructations that are aggravated after eating, I think patient is better by walking. That's what everybody
even
sees.
People of hysterical eructations, they press and they get bursts.
That's yeah. I think this is getting common into everybody's practice. Doctor, either ye press kiya dekho, I don't know what that, but definitely Asafoetida.
Yes, and especially for necrosis of the bones. Asafoetida is one of the remedy. I have also found use in avian cases. I've seen Asafoetida when they have typical gastritis, because Asafoetida is more of syphilitic tendency nature. So all the caries in the bones and the vertebrae, you can also see Asafoetida to be one of the good remedy.
One of the great remedies that was taught that is going in the legacy of Dr. S.R. You must have heard the name of Dr. S.R. Vadia, sir. In his book,
yes.
in his grandson is a friend of mine, and he has taught us that avian cases start using tub recidum. I guess tub recidum, we never knew about tuberculinum recidum, but in high potencies it is giving wonderful results for avian.
Wonderful.
So let's go to Asaram.
Asaram has so much of irritability in the ears. If you try with all the children or any when you learn in a classroom and somebody plays with a chalk and just drags the chalks on the board and they are like vibrating. They feel their nerves feel inside and they get very very sensitive to that. That's a typical of Asaram europaeum. And the next is Theridion also. So it has been very important relationship with Asaram. But Asaram is another remedy for more of, they complain of, I feel completely light-headed.
Yes.
Or complete, my body is floating. I feel a lot of light feeling in the body. I don't feel like my body doesn't exist, or like, they have more of no weight in the body, you can say that. No sense of lightness in whole body, they feel of Asaram.
The next is Asclepias Tuberosa. Asclepias Tuberosa is also the most important thing here is secretions, how the secretions are. In various diseases, Asclepias tuberosa is indicated. It can be indicated in gastrointestinal tract or respiratory system, but the secretions are highlighted in this, and the secretions have to be like that again of a rotten egg. The stool smell like rotten egg. They burn like fire. That's one of the most important symptoms that I think. Again, in advanced cases of pneumonia, again when there is expectoration which is coming out is very rotten, smells like egg. That's what is highlighted. It's a very small remedy.
Yes.
Asteria
and it's also
Rubens.
Asteria Rubens,
please.
we all know. No, it's fine. Asteria Rubens, like I was telling, like made of a cancer of mammae.
Yes,
with inverted nipples and especially inverted nipples, and they have what red livid spot as referred to Allen's keynote, and even they have red livid spots typically. It's visible, and you can use Asteria Rubens in that kind of cases. It definitely helps in mammae of cancer.
Asteria Rubens is also a very good remedy, which we have like they have mentioned in a lot of references for acne and herpes zoster.
Correct. And just to add a little, Asteria Rubens is one of the remedy which has a gelsium-like feature, which Herring has clearly written, muscles obey to refuse the will.
Yes.
Asteria Rubens is also one of the remedy when you think of gelsemia.
Yes. Okay. Last remedy, a grand remedy, a very big remedy is Aurum. Aurum again will act, I guess, on all organs, starting from your mind, where where it is indicated in depressive disorders, where it again for syphilitic tendencies, where patient is into severe depression may have had multiple attempts of suicide.
Yes, and Aurum people will generally, they never speak of it; they just do it.
Yes, they just do it. It's like an end. It's like an end for them.
Aurum and
please.
Yeah, Aurum is like more of hopeless states in a life, and they don't know what to do about it. Even in, I have seen chronic hypertension due to the stress and this anxiety going on. Yes, stress level. Aurum wonderfully helps in those kind of cases when they have this deep thinking of suicidal impulses and all, and they're brooding about their griefs a lot. You can think of Aurum in those kind of cases.
Okay. So Aurum is for depression, is for hypertension, and is also a very importantly highlighted remedy for poignant palpitations.
Yes, tachycardia. That's why even in cardiac hypertrophy it has been written. Cardiac hypertrophy and angina in aortic valve disease.
Yes.
Also, Aurum is one of the remedy which is helpful, but it's more of a chilly remedy.
Yes.
Aurum is chilly.
And last, we'll conclude this session by thinking of my favorite author, Dr. S.P. Kopigar sir. His uncle had used Aurum Metallicum for as a solvent, where he said where there's a case of a shoulder joint there was a big exostosis of the bone, and he gave high potency, I guess 10 m or potency, just one dose, and just leave it for 3 months. And gold is a solvent, and it will definitely dissolve all these bony growths.
Exostosis.
Exostotic
Same with Hecla lava.
Yes. Same with Hecla lava. So that was all for first for A. Thank you so much for everybody, all of people. I think a lot of people enjoyed this. A lot of people were talking amongst themselves. There were a lot of senior physicians who were there in the chat, and they really participated. I think everybody had a great time. Dr. Mayur Jaswani, Dr. Rehana ma'am, our friend Dr. Anam Zahir was there, and there are a lot of Atul bhai. There are a lot of homeopaths who were constantly connected. They were constantly writing. Thank you so much for
and they were
showing
sharing their
so much of
interest.
interest.
Their understanding.
Yeah, you were
very
saying your
beautiful.
inputs. We are reading, but because we are in this flow, we might not have every time mentioned. But you were really great. Thank you so much for joining. Thank you so much, Jitesh bhai, for taking time out on the Saturday evening. And we'll surely connect to all of you again with the next alphabet. Please stay connected on Instagram for the next update. Thank you so much, Jitesh.
Thank you so much. Thank you so much. Thank you so much. And we'll meet soon. Thank you, everyone. And yes, thank you. Bye. Good night.
Good night.